Hi everyone, welcome back, and in today's video we have a very important and interesting topic to discuss from electrotherapy, and that is transcutaneous electrical nerve stimulation. You might know TENS as one of the most important modality. If you're a clinician, you would be using TENS in day-to-day life. You might have been practicing TENS for your practical examinations if you're a student, and in theoretical point of view, TENS is being asked as often an essay question or at least a short answer or a long answer question comes from TENS for any of the electrotherapy examination. So this is an important topic, but I'm sure that it's very simple and we will make it more interesting to learn in today's session. So we will be discussing about the TENS, introduction of the TENS, different terminologies associated with the TENS, and the principle of application of TENS, and most importantly, the modes of TENS in today's video. As I told you, TENS stands for Transcutaneous Electrical Nerve Stimulation. The word itself tells you some hints, gives you some hints like it's an electrical stimulation, but it's an electrical nerve stimulation. So the nerves are being stimulated. So TENS is a modality, electrotherapy modality that is used to stimulate the nerves to have some effects. We'll see what effects has that. So TENS is an electrical nerve stimulation. It is non-invasive, you know that. If you have seen the TENS machine, the way it's been applied to the patient, it's non-invasive. We don't do any invasive techniques on that. And primary aim of TENS is to, any guess? Relieve pain. Yes. The primary aim of TENS, or the main purpose of use of TENS, is to relieve pain, either nociceptive pain, either mechanoreceptors pain, or musculoskeletal pain, or any type of pain. TENS is used to relieve the pain in particular, and it's a low frequency electrical stimulation modality too, and it's a low frequency electrical nerve stimulation. So let us summarize what we have learned. TENS is an electrical nerve stimulation technique. It's a low frequency modality, and the primary aim is pain relief, whether nociceptive pain, whether neuropathic pain, or musculoskeletal pain, and it is non-invasive in nature. Now, how do we define TENS? TENS is the application of electrical nerve stimulation to the skin. How? Via surface electrode to stimulate what? The nerve fibers. We just answer a few questions to define the TENS. TENS is the application of, it is an electrical nerve stimulation to the skin or to the body. Through, how do we apply? We don't apply through invasive indwelling electrode, but we apply through surface electrode. Through surface electrodes, for what? To stimulate the nerve fibers or for pain relief. So TENS can be defined as the electrical nerve stimulation, can be defined as the method of electrical nerve stimulation to the skin through surface electrodes to relieve pain or to stimulate the nerve fibers. So that's the most important few basic introductory concepts about TENS. Now let's see different terminologies associated with TENS. It's not much important, but in few examinations, like if you are going for a competitive exam, sometimes they might ask different terminologies of the TENS. So TENS, that stands for Transcutaneous Electrical Nerve Stimulation, TES. It is also known for TENS, Transcutaneous Electrical Stimulation. So TENS is also known as Transcutaneous Electrical Stimulation, or TNS, Transcutaneous Nerve Stimulation. So all these different terminologies denote or points the same thing, that is the transcutaneous electrical nerve stimulation. So they can alternatively ask any of those terminologies: TENS, TENS, TNS, and TEES. And now we see what is the principle of application of TENS. Any electrotherapy modality, when you learn, you need to understand what is the principle behind application of that electrotherapy modality. Can anyone tell me what will be the principle of application of TENS? Any idea? You know that TENS is a nerve stimulating modality. It stimulates a nerve. So TENS, how does the TENS act, or what is the principle of action of the TENS? TENS stimulates the nerves. What type of nerves can TENS stimulate? It's the afferent nerve, stands with afferent A, or the efferent nerve. Any idea? It will be definitely the nerves which carry impulse to the brain and spinal cord. It's not the nerves which are coming from the spinal cord or brain towards the joint. They stimulate the nerve fibers which transmit the impulse. That is the afferent nerve fibers. So TENS stimulates the afferent nerve fibers or the sensory nerve fibers so as to relieve the pain or produce pain relief. So let's see what is the principle of the TENS or transcutaneous electrical nerve stimulation. So TENS provides afferent nerve stimulation for pain management. It is a technique of neurostimulation that affects the sensory nerves by modifying the impulse. So it's a neuromodulatory technique which affects the sensory pathways by modifying the signal. So basically, the principle of TENS is that TENS provides afferent nerve stimulation to produce pain relief by two important pathways or two important mechanisms. One is the pain gate mechanism and one is the endogenous opiate mechanism. We are not able to discuss in detail into pain gate or endogenous opiate mechanism in this video, but of course if you need those videos, I can come up with those videos in maybe in the next few weeks. But for time being, understand TENS produce nerve stimulation for pain management through endogenous opiate mechanism or pain gate mechanism. So principle of application of the TENS is that TENS provides afferent nerve stimulation to provide pain management or for pain management either through the endogenous opiate mechanism or through the pain gate mechanism. It is a technique of neuromodulation that affects the sensory pathways by modulating the impulse. So that's the most important things that we have seen with the introduction, with the terminology, and with the principle of TENS. Now we need to understand or go on to the modes of our TENS. There are different modes of the TENS. 5 different modes are there in which we can apply the TENS. This is an important question. This can be asked either as a short note question, what are the important modes of the TENS, or either one of the modes can be asked. So different modes of application of the TENS. First one is, any guess? Yes, conventional TENS or high TENS. Second one is low TENS or acupuncture like TENS. Third one is burst TENS. Fourth one is brief TENS, and fifth one is modulated TENS. So what are the different mechanisms, modes of application of the TENS? One is the high TENS or the conventional TENS. Second one is the low TENS or the acupuncture TENS. Third one is the brief TENS. Fourth one is the burst TENS, and fifth one is the modulated TENS. Let's see what each of these modes are. The first one is the conventional TENS. Conventional TENS is the most common electrotherapy modality in TENS, or conventional TENS is the most common, most widely used in clinical scenarios, and it is known as the conventional TENS or high TENS. So it is of a high frequency and of low intensity. It is of high frequency and low intensity. That is why the term says that it is high. So high frequency and low intensity. High frequency, low intensity modality. The word tells it is conventional, so we use it in a day-to-day basis. Right? It is having short duration of activation, short duration or short pulse duration, nearly 150 microseconds. And the treatment time is usually 20 to 60 minutes and primarily used for pain relief, acute pain or post-operative pain relief. And the conventional TENS is mostly applied to the dermatome. So these are the few important things that we have seen regarding the conventional TENS? Let's just summarize. It's the most widely used modality. It is the most common and first line of treatment. The word tells you it is of high frequency, which is around of 90 to 130 hertz, 90 to 130 hertz, and then it is of a short pulse duration or short duration, 150 microseconds. It is of low intensity. The treatment time is 20 to 60 seconds, and it is primarily used for pain relief, which is the acute pain relief and post-operative pain relief. And the electrotherapy, the electrodes are placed on the dermatomes for a pain relief or for activation. Now we need to see how the high TENS provides the pain relief. I already told you in the principle of application of the TENS can either give pain relief through endogenous opiate mechanism or pain gate mechanism. So in high TENS provides the pain relief through the pain gate mechanism. So high TENS activates or acts through the pain gate mechanism. That is the gating of the pain. So it closes the pain gate so as to relieve the pain. So how does it activate? So you know that in body, the pain impulses are being transmitted through the small diameter A delta and C fibers. So these are the two type of fibers which transmit the impulse of pain either to the spinal cord or to the brain. That is the A delta and C fibers, which are the small diameter fibers. So for example, I have an injury in my wrist. Maybe it might be a tendinitis or it can be an acute inflammation. So rapidly from there, due to that injury or inflammation and physiological process happening over there, the impulse of pain will be generated. This pain impulse or the pain will be transmitted through the small diameter A delta and C fibers. Small diameter A delta and C fibers. Now here I'm going to electrotherapy clinic, or I'm taking my TENS and applying electrodes of the TENS on this side, maybe in different positions. So what happens is that the TENS, activation of the TENS, you know, that stimulates the mechanoreceptors in the area. The activation of the TENS stimulates the mechanoreceptors, and as a result, they stimulate the large diameter A beta fibers. So this mechanoreceptor stimulates the activation of the TENS. The working of the TENS stimulates the mechanoreceptors, and as a result, the large diameter A beta fibers are being activated. Once the large diameter A beta fibers are activated, this fibers transmits the impulse and superimposes on the top of, or superimposes on the A delta and C fibers, which are producing pain for us. So a superimposition of the fibers by the A beta fibers, which are the large diameter fibers, on A delta and C fibers occur at the substantia gelatinosa of the dorsal horn of the spinal cord. You might know it when if you have studied the pain gate mechanism. So at that substantia gelatinosa of the dorsal horn of the spinal cord, these impulses are superimposed, and as a result, the pain is being blocked. The A delta and C fibers have been blocked or gated, and as a result, pain is being relieved. So that is how the high TENS activates the pain gate mechanism and produces the pain relief. But you know that it is a short-term relief. It might last either up to the time that mechanoreceptors are stimulated, or maybe a few minutes of a few duration after the stimulation. So it is of short duration, but rapid onset of the pain relief can be achieved in high TENS. So high TENS stimulate. Let's see once more how high TENS produce the pain relief. So it stimulates the mechanoreceptors and activates the large diameter A beta fibers, superimposes on the A delta fiber at the substantia gelatinous of the dorsal horn of the spinal cord. Rapid onset but temporary analgesia. It also help in It also produces the pain relief by elevating the release of inhibitory neurotransmitters like GABA and serotonin, as well as reducing the release of excitatory neurotransmitters, which can further increase the pain. So that is also another mechanism or another method of application of which one you got, the high tense. Now the low tense or the acupuncture-like tense. The word tells you it is of a low frequency but high intensity. Acupuncture like tense, high intensity, low frequency. It is used when the high tense is not producing the pain relief. In conditions where high tense cannot produce or is not efficient in pain relief, for example in chronic musculoskeletal pain. The chronic musculoskeletal pain, it is of a large long duration of pulse duration is long, around 200 microseconds. The intensity we know that is of low frequency and of a high intensity. The frequency is around 2 to 4 hertz and the pulse duration, as I told you, is around 200 microseconds, and the treatment time is over 30 seconds, and it is usually applied on the skin, over the dermatome, over the acupuncture points or the pain or the trigger points, etc., and used for chronic pain relief. And use is like it is produced low or slow pain relief, but it lasts longer. So low tense or acupuncture tense is a hyperstimulation mechanism which is used when high tense is not applicable or not producing results. It produces the pain relief in a slow manner, but it lasts longer. The word tells you it is of low frequency but of high intensity and low frequency. Frequency is of 2 to 4 hertz. The pulse duration is over 200 microseconds, the long pulse duration, and used primarily for chronic pain relief. The electrodes are being applied on the skin, the acupuncture site, or the acupuncture points or trigger points in the human body. Now let us see how the conventional tense, we already saw how conventional tense produce the pain relief. Now let's see how low tense produce the pain relief. So the low tense produce pain relief by endogenous opiate mechanism. The endogenous opiate mechanism. So what does that stands for? What do you mean by endogenous opiate mechanism, and how does the low tense produces the endogenous opiate mechanism? You know that the low tense produce muscle twitches. You know that it is of high intensity, so it produces twitches in the muscle which activates the A delta fiber. Which one? A delta fiber. Small diameter A delta fibers itself, they activate the A delta fiber. So we have a pain site, we apply the high tense, the low tense or the acupuncture like tense, it produces the muscle twitches which further activates the A delta fiber, which of course are carrying the pain. So they activate the A delta fibers further, which results in the activation of the interneurons, and as a result, when the interneuron activation takes place, it releases the endogenous opiate mechanism, or it activates the endogenous opiate mechanism by releasing the opiates like encephalin and endorphins, which produces the pain relief. So once this body's opiate mechanism or these chemicals in the body are being released, we get a very good pain relief. And once this is because of the release of these opiates, what happens is that the pain relief lasts longer. So here there is only one single difference. There in the high tense it was activating A beta fiber. Here it is been activating the A delta fiber itself. So the muscle twitches produced by the low tense activates the A delta fiber which results in the activation of interneurons, which further activates the endogenous opiate system by releasing the opiates such as the encephalin and endorphin, which results in pain relief. Slow onset but long-lasting pain relief. Let's just see, as I told you, produces the muscle T2, stimulates the free nerve endings and activates small diameter A delta fibers, which results in the activation of interneurons, which results in the endogenous opiate mechanism, releasing in the encephalin and endorphins from substantia gelatinous of the spinal cord itself, and further results in the presynaptic inhibition of the pain, which is a slow pain relief but lasts longer. So that's all about the introduction of the TENS, the principle, the terminologies, and in different modes of the TENS. We have already discussed the acupuncture TENS or the low TENS and the high TENS or the conventional TENS. Then we have the brief TENS, the modulated TENS, and burst TENS to discuss, which we'll see on the next video. Until then, stay tuned. And if you enjoy this video, don't forget to click the like button and leave a comment in the comment